Though most of the restrictions put in place in March to curb the spread of COVID-19 have been eased, life is yet to get back to normal, and many Ugandans want even the remaining restrictions lifted because they continue to adversely affect their livelihoods. Government has maintained that certain restrictions on movement, public gatherings and the closure of churches, schools and bars will continue for some time. Today, doctors under their uniting body, the Uganda Medical Association, have said if the lockdown is to be lifted, it should be done in phases.
You can see that we are in partial lockdown compared to a few months back. However, this has to be well regulated, because then we would go into the phase of community spread and will end up with very serious casualties. COVID is very highly infectious.
The doctors admit that the lockdown has had effects on the economy.
The public has been fatigued. Economic crisis is hitting hard. And people have been patient, hoping that the lockdown would be eased.
Their comments come after Dr. Baterana Byarugaba, the executive director of Mulago Hospital, was quoted in the media saying the lockdown should be lifted because COVID-19 cases in Uganda present only mild effects. Baterana has since said his views were misrepresented. Early this week, the Speaker of Parliament also said government needs to find ways of handling COVID-19 rather than keeping Ugandans under lockdown because the disease is going to be around for a while.
I really want the government to be more serious about the issue of this COVID. Can't we learn to live with it and just organize our society to manage it?
The doctors were launching the second phase of the distribution of personal protective equipment to regional hospitals in the country.
Personal protectives are quite a fast-moving supplies, and therefore the need to have adequate stock of these is very important, along with the training of health workers on infection prevention and control to be able to provide high level of services.
27 health workers have so far tested positive for COVID-19. Juma Kiria, NTV.